friends, participants to the summer school, welcome to this last session. My name is Joseph Figueras. I'm the director of European Observatory, and it's an enormous privilege today to gather with Reinhard Busse to facilitate this very last session. To me, it's probably one of the most exciting sessions. They've all been very exciting. We heard about technology, we heard about innovation, we heard about digital health, we heard a lot of best practices, we heard a lot of cutting-edge ideas. The question now is, have we reached our ceiling? Can we do more? We heard at NAUSEM, here and elsewhere, that many of these technologies were there before COVID. And during COVID, we saw it, we've seen every day the numbers. All of a sudden, the regulatory aspects were resolved, addressed, the cultural aspects somehow were adopted, they were adapted to the situation. The money came, funding the systems, incentivized the professionals, the citizenry accepted it. What happened? How do we harness all that energy, that change? Because I will argue, we are not at the ceiling. There's much more we can achieve. Today, in the session, I hope many of you were there with the Veneto, we saw lots of innovation, and we saw some of the reasons and some of the causes that took place in the Veneto, but we saw some areas that they were more successful than others. Why they were more successful? What were those key elements that explain implementation? So today, I don't want to expand too much because we'll talk about that in a minute with those who really know. We're going to talk about implementing change, making it happen, harnessing all those developments and really maximizing their efficiency, their impact in our health systems. So before we introduce the panelists, I'd like first to introduce Natasha Zopardi-Muscat. She is the director of the Health Service and Public Health Department at the WHO, who's going to give us a bit of an introduction about the transformation, the digital transformation, and what the WHO office is doing in that regard. Unfortunately, there was a problem of schedules with a country visit, and Natasha couldn't be here with us, so she has recorded her presentation. So after that presentation, we'll thresh out a bit the issues a bit more. I will introduce the exciting panelists we have for you today here.
Good afternoon. I'm Natasha Zopardi-Muscat. I'm very sorry that I was unable to join you live for the event this afternoon. And it's my pleasure to just over the coming minutes share with you some of the interesting initiatives that we are taking here in the WHO office in the European region when it comes to digital health and how we see that digital health has such a key role in transforming health systems in a post-COVID Europe. So perhaps to start, just very briefly to remind you that we have a European program of work that will run until 2025 with a political mandate for the COVID era. Our two overall objectives are leaving no one behind and supporting the leadership of health authorities. Of course, this is very much related to our triple billion goals of universal health coverage, protecting people in health emergencies, and supporting health and well-being. But what have we learned from COVID? We've learned that it's no more business as usual, and as we head forward into the recovery, we need to see what needs to be done to build more resilient and robust health systems. What are some of the digital health lessons we have learned? I think basically it's very clear that the pandemic has exacerbated social inequalities. I think it's also very important that we need to look forward to strengthen the digital competencies of the health workforce. We've had a very public discussion about the public acceptance of digital technologies and the fact that this really requires robust privacy protection, and that digital solutions must go hand in hand with human rights and civil liberties, and the importance of providing accurate information and the harm that is being done through deliberate disinformation particularly, for example, also in the case of encouraging vaccine hesitancy and the conspiracy theories around that. So I think I would like to focus a little bit on primary healthcare, because primary healthcare is one of the key priorities for us in WHO Euro, and at our upcoming regional committee we shall be launching and presenting a document that is talking about really realizing the potential of primary healthcare in this post-COVID era. And I think what we have seen is that during the COVID pandemic, we've seen further digitalization of primary healthcare, and that this is really built around trust between the providers and the patients. And this is a very important basis. The importance of a single point of entry. Primary healthcare provides a single point of entry, and the importance that this is providing a single point of entry for citizens' health data, and that it is linked to the wider then hospital network and other solutions. The digitalization, in a way, has also been able to put citizens at the forefront of shaping the type of care that they need and that they require, and bringing the health system to provide more tailored and fit for purpose support when, where, and how the citizen needs it. But that this only happens when we have citizens who are literate in digital health. And of course, the fear is that the ones who are least literate are the ones who need our health systems most. So another aspect that I know has been discussed earlier this week too is the importance of ensuring that you have the right legal framework, the appropriate reimbursement mechanisms, that digital solutions become part of the package of healthcare and that providers can be reimbursed accordingly. A second element is, do we really know enough about safety and quality of care? Of course, for many years, this was what was holding back the digitalization of health services. But now that we have had to jump in because we have had no choice at all, it is also time to take stock and to ensure that we have certain standards and certain protection and quality mechanisms built in. And I'm delighted to say that the office that we have launched together with the support of the Greek government in Athens is going to be looking precisely at this theme in the coming months. And of course, we need to make sure that remote consultations will be sustainable after the COVID pandemic crisis, so to say, that we don't revert back to the old ways, but that we find the sustainable solutions that allow us to move on and to move forward into this new era. Further information and lessons learned around the data. I think we've seen very clearly how important it is to have platforms that are able to support the different kinds of formats, to communicate with the public in a way that really engenders trust, and to ensure that we respect the ethical boundaries. And moving on, I think what we see is that COVID has removed some of the barriers to digital health adoption. It's also highlighted the importance of having timely access to credible, comparative and consistent data to be able to inform an evidence-based approach to the measures that are taken in a very timely and relevant manner. So, for example, for years we've talked about portable vaccination certificates for childhood immunizations, and we've debated endlessly about the way in which these should be configured. Here comes COVID, and suddenly the European Union gets together and finds the way to produce a smart vaccination certificate that is recognized by all countries. Isn't this just great? But how do we make sure that we capitalize on this going forward? And our next step is to ensure that we can actually have this doorway to digital certification systems for immunization that are portable, that are recognized, not just within the European Union, but beyond the confines of the European Union, and that these are the tools that citizens can carry in their pocket wherever they can go, that are portable and that are also reliable and can be verified. So I'm sure you've heard earlier this week also about the forthcoming report on the Pan-European Commission for Health and Sustainable Development. And one of the topics that has been considered is the importance actually to strengthen data as a response to what we have seen in the COVID pandemic. And of course, to enhance our national data coordination mechanisms, but also to develop a pan-European data roadmap and to really find ways in which we can respect and empower individuals to have better understanding and control of their health data, of its uses, and how they can determine when, where, and how it is shared with others and for what purposes. So what are we looking at? We are looking at a digital flagship that continues to accelerate the promotion of safe and inclusive digital health services as a mechanism to help us achieve universal health coverage. I'm very passionate about the fact that investment in digital technologies and digital health should not be seen as an end in itself. And whenever I meet a policymaker who tells me that digital health is a priority, I always ask, why? What do you want to achieve through investment in digital health? Digital health should not be an end in itself, but is it about having better quality? Is it about reaching those who you can't reach so far? Is it about having a more efficient and effective health service? What do you want to improve? And therefore, how can you use digital health to help you improve that? And what do you want success to look like? And sometimes I think there is a bit of a gap here. So we continue to reinforce the fact that we invest in digital health as a means of improving universal health coverage. Secondly, we invest in digital health to help strengthen our preparedness and response in emergencies. And third, of course, the potential of leveraging digital health technologies to improve health and well-being and to get people to be comfortable and empowered, and that's part of their way of life, that they actually use digital technologies as part of their daily routine. So our priorities are really to be looking at digital primary healthcare. It's fine to look at digitalization in hospitals. We've done a lot there. We've got fantastic systems, and they have really supported us to be able to continue to provide essential services, diagnostic services, reaching out during the pandemic. But what when it comes to primary healthcare? That's where we really need to invest in digital health infrastructure, in training of our digital health workforce, and in interoperable solutions so that our primary healthcare systems can interface with the hospital networks that they relate to, as well as with other services, social services, mental health services, public health services, amongst others. Secondly, we need to really strengthen the digital skills of the health workforce so that the health workforce is comfortable, is empowered, and can really move forward and lead the way in using digital health services confidently. But more than that, we need to understand how we can use digital technologies better to make up for the shortfall that we have in our health workforce, both quantitatively and qualitatively. So how can digital technologies, how can artificial intelligence help us to make up for our huge shortages in the health workforce? Third, we really want to make sure that digital health and digital technologies and the digital future doesn't continue to grow the gap that we have and the health inequalities. Because far too often it is those who are at the bottom of the pile who are pushed further to the periphery because of their inability to successfully master, access and utilize digital technologies, and so they are left further behind. And finally, because this is also another priority for WHO Europe. It's about how can we use digital technologies to help us to transform mental health services. We know that there's a huge mental health need in the midst of the pandemic, but also beyond. That pre-pandemic already, we didn't have the workforce and the services in large enough numbers to meet the need and demand out there. How can we use digital networks and platforms to help us go further, to help us do more, to help us meet the needs of a greater number of the population? Because during the COVID pandemic, we saw, of course, that those with pre-existing mental health needs were adversely affected, but that even those who were previously not affected also became vulnerable, that it could have really affected any one of us. This is a huge agenda. Nobody can do it alone, and so we are very keen to forge partnerships. We see that at the moment there's a lot of knowledge, but it's very scattered. The industry, NGOs, international partners, governments, and we need to bring this all together so that we really harness the power of partnership in order to bring about the changes that we need. And we need to find new modalities of working together to be able to do this. And I think that COVID, in a way, has provided us with an opportunity to understand that no single entity alone can bring about the change that needs to be brought about. And of course, we are very keen to ensure that we align our agendas and that then we use our expertise where it is needed most to complement our efforts. Thank you very much for giving me this opportunity, and I'm sure there will be a very interesting panel discussion.
Yes, welcome everybody. My name is Reinhard Busse. I'm the summer school director. And if we were on a live summer school, I would now say thank you, Natasha. Thank you for making this very clear presentation. I think you all agreed. Natasha has beautifully summarized what this summer school is about. That we take the opportunity of the pandemic to look, to reflect on digital health, and we have done so over the last days. We started on Monday by reflecting where were we in regard to digital health before the pandemic and what has changed partly dramatically during pandemic. Then during the last 3 days, we looked at the potential of digital health for the creation of information from data on Tuesday, for clinical care on Wednesday, and Natasha has stressed this aspect of the improvements in clinical care, both in primary care and in hospital care. And yesterday we looked at the potential of digital health for research. And as Joseph already said in his introductory remarks, today it's about implementation. So we knew we had weaknesses and potential before the pandemic. We have now all had a crash course in digital health over the last 1.5 years. And now, as the summer school topic is, we now look into the post-pandemic future for digital health. And we will not have more presentations today, but have a lively round with well-known experts whom I think I don't need to introduce, but I will do so anyway. I start because Natasha is not live with us, as Joseph said. I start with Clayton Hamilton from WHO. He leads the Digital Health Flagship program and can introduce to all of us what WHO is doing in respect to digital health. I stay with the international organizations and introduce to you Isabel de la Mata. Isabel is a principal advisor for health and crisis management at the European Commission in the DG Sanco, and also much involved over the last 1.5 years, both in the pandemic management as well as the digital health improvements during that period in particularly. Then I introduce to you Antonio Maritati from our host institution, the Veneto region, partner of the European region, where he's always difficult to translate, the director of the health committee of the Veneto region, and well aware of these issues. And you heard, those of you who heard this morning's session know that Veneto is one of the innovators in this respect. And last but not least, and you have seen him starting the summer school on Monday with the keynote, where did we come from? How do we structure digital health? My dear friend Nick Fahy, senior researcher at the University of Oxford. The panel discussion will be moderated by my dear friend Joseph, director of the European Observatory. Over to you, Joseph.
Thank you very much indeed, Reinhard. A real pleasure again to be facilitating this panel. So basically what we have today, colleagues, is the protagonists of this summer school. We have the co-directors, we have Nick Fahy, and then at the beginning, and then Dimi Pantelli at the end, your co-directors, Reinhard Busse. And then we'll have the three organizations that are partnering with the observatory to make the summer school, I hope, a success. So let's start with Nick. Nick, you and I share a number of obsessions, and all of them positive and in the right direction. One of them is transformation, is change, is implementation. And you have authored, together with Gemma Williams, this beautiful brief that will be sent to all participants next week, is now being typeset as we speak, analyzing the digital health innovations during the crisis. And one of the aspects that you pointed out very briefly, too briefly for my own taste and the taste of us as organizers, was the whole area of implementation, of transformation. We learned a lot during the week already, but we want to hear a bit more about that from you, as well, beginning to reflect what you heard. And we want to hear about the hard elements, the regulation, the finance, the quality, the training, and the softer ones, the transformation, the organization, the culture, and all that in a couple of minutes or so. So if you could reflect on those a tiny bit, Nick, and then we'll use that as a hooks to ask questions to our organizations in the panel today. Nick, the floor is yours.
Thank you very much, Joseph, and thank you, Reinhard, also. It's been an absolute pleasure to be able to co-direct this summer school this year. And indeed, Joseph, you're absolutely right. This is a shared obsession, I would say. And I'm just going to, with your agreement, colleagues, I'm going to go back to a couple of the slides that I showed at the start of this week. Once I can get them there we go, which are around this whole area of implementation. This one isn't my work, I have to say, but I think it's incredibly helpful. So we have this whole field of what is called implementation science. And the reason we have this field, a whole scientific discipline just focused on how do we bring about change in health systems, is because it is, forgive me, colleagues, for being blunt, it's Friday. We've morally all been together on an island for a week. It's bloody hard. That's your basic message from the research. It's really hard. And when you look at this model, the key message for me, if you look at all of this, because this is Dan Schroeder on the right, you can see Dan Schroeder's model on the consolidated framework for implementation research, which is for me one of the best sort of bringing together of these different messages. And on the left, you can see Ross and colleagues' application of this to e-health. There are so many different elements. And Joseph, you talked about the hard elements and the soft elements. The overall message for me here is that this is mostly what we call soft. It's about people. It's about organizations. It's about how well does this fit with with the way that people work now. It's about concerns of professionals about their loss of autonomy, about whether or not they're going to be responsible for patient, some kind of particular difficulties. And yes, of course, there are these wider elements. But for me, the key message which comes out and which we heard again and again through the week is that making a success of digital health is much less about the technology and much more about how do we support people and organizations and systems in changing. And digital health is part of how we change for the better, but it's the change that's the difficult bit. In terms of policymakers, because we know that so many of our audience in this summer school of our policymakers, this is our framework for the policy brief, which is sort of a way of thinking about the different elements or the different types of mechanisms that we have as policymakers. So we have legal frameworks where we talk about things like liability and who is responsible for what. We have the financial frameworks. Joseph, you mentioned reimbursement and payment systems. It's amazing how many countries still do not have clear mechanisms for paying healthcare providers for care provided through digital means. Quality, we heard during the week, for example, about the investment that Italy has made through the ISS about providing training in this and doing so in an online way. That element of supporting learning is really important. And platforms, we've heard about so many innovative platforms during this week. But the overall message I would want to provide really is that, for me, one of the best ways of thinking about this is that this is a process of learning and change. And our job as people from outside the system is to be or people who are looking at the system as a whole, rather, is to be supporting the people inside the system in bringing those changes. Because we talk about innovation and implementation as though the innovation is the clever bit and then the implementation is just putting it into practice as though that's easy. And it's not easy. Every instance of implementation is actually another instance of innovation. And that's our challenge, is how we can make that happen and how we can realize the potential of digital health, which we've heard so much about during this summer school. And you said only a couple of minutes, so I'm going to stop there, Joseph. But for me, we've heard so much about this potential. And our challenge now is how do we support people in actually really putting it into practice?
Brilliant. I'm not letting you go then yet, Nick. That was exactly what we wanted. One area that actually came up today during the Veneto session, which explains not only the innovations in that region, but reforms in many other areas, is the environment, is the innovation environment. You've been collaborating with the Monti Commission, which we have the Secretariat with the WHO. You've been working with a number of member states through the Observatory and others, such as Finland and Austria. Can we reproduce this environment? We made this joke several times, to do what the Estonians do, you have to be Estonian, you have to have their DNA. Can we reproduce the DNA? Can we have those environments to actually steer innovation, steer digital health, or we just don't?
I think we should be absolutely optimistic. I think the key to this is we can't all suddenly be Estonian. We can't take that and copy it any more, Joseph, than, for example, when we look at the amazing achievements of Spain in organ transplantation. Everybody looks at Spain and organ transplantation. You can't suddenly make the rest of Europe Spanish. We all have to fit things within our own system. So I think the way to think about this is about how we learn from each other and how we look at something that's happened somewhere else, but then we also support that process of adapting it and changing it and fitting it to our context and the way that we work in each different, sometimes system, Joseph, and as you all know very well, many of these systems aren't even national systems, they're regional systems, and they'll be different in different regions. But one of the things that comes out very clearly from that process of, from the innovation studies literature and from the work that we've been doing as the Observatory, is that the innovation comes in the spaces between different institutions. It comes in the cooperation, it comes in the partnership. And so the classic model is, for example, the triple helix, where you bring together public authorities and universities and industries. And from the observatory, I like us to talk about a quadruple helix, where we bring together the health system as well as the sort of the fourth of these strands. And we don't need any one of these, we need all of them. So our challenge is, how do we look at these other places, be inspired by them, and then create these spaces for partnership and collaboration within our own systems? And if we can do that, if we can create that environment, it's like gardening. You can't stand over the plants and shout at them and they will grow faster, although sometimes I'm tempted. But if you create, there are people who play music to their plants, and people try all sorts of things. But if you're the right kind of gardener and you create the right conditions in your specific place, good things will grow.
All is about learning from the Veneto, learning from the Estonians, from the Spanish, so many other countries we heard these days, and regions and particular areas where they created that environment. So much more transformation research, much more translation research, transfer research that we've been talking about. I'll come back to you in a minute, Nick, because I have other questions I'd like to hear your views on. But let me move now actually to the first of the two organizations we have today, whose job, Isabel de la Mata, has been introduced already, the European Commission, is creating those kinds of environments, Isabel, is supporting the member states so they can learn from each other. They have the funding, the deregulation, the best practices. So Isabel, I'd like to hear a bit about the work of the Commission on this area. We had many colleagues of you during these days that told us best practice in so many areas, but now we have the privilege to have you as a senior leader within the House to do some reflections on that. Today is the day I get to ask the questions I never ask. So today I'm going to ask some of these questions, Isabel. One of them is interoperability. You have these working groups working on this area for years now, and they keep saying, what we need is more interoperability. Surely it's not rocket science. Why we don't still have interoperability in health between our member states? What are we doing wrong? I know, Isabel, you single-handed, and some of the colleagues in the Commission have all the tricks on the book. You have all the mechanisms, but why is it not happening?
Well, but we are working for this is happening, and we are putting all the different steps, working with the member states, supporting the member states, funding the member state to be able to achieve that. And why we are not yet there? First, because the health systems historically, as you know, have been outside of the European Union, have been something of the subsidiarity competence of the member state versus competencies of the European Union. So the financing, organization, management of the health system is the competence of the member state, and we have been stuck there for 4 years. So fighting over who is the boss, instead of advancing more on doing that compatible. Second, because it's something that is very dynamic. I mean, we could do compatibility or interoperability of static things as having, for example, the driving license that are compatible among all the member states, and a policeman in Spain knows if the driving license of a Belgian citizen that came on holidays is to the date is fake or not. We can do the same with the education systems to check the diplomas, but the health system is much more than that. It's not just a piece of paper in a given moment. It has to be something dynamic, and to have this dynamism is not so easy. And we cannot forget that in most of the member states, the interoperability or the compatibility doesn't exist among all the different components of the health system, between among regions, among hospitals and primary health centers, the private professionals. So it's not so easy, but we are doing that. Also, we can demonstrate when there is a need. Now, I don't know I mean, some of my colleagues have presented you several things, but the digital certificate is available and working in the member states in the 1st of July, in all the member states, in the 27. So independently that the different advancement of digital health in the different states. Another issue that you mentioned at the beginning is that the issue that the health systems have different structures in the member states. We have some that are national health system, others that are based on the classical social security, so based on private professionals. The professionals, we need to discuss how they are funded, how they are paid for the even for the non-digital, but also for the digital application. But the others, the national health systems, usually they receive a salary, so not this issue of competence. And the same is for some of them don't have to think. I mean, the digital solutions or the interoperability, internal interoperability comes given by the state, by the national authorities. For others, they need to do something on purpose, the private professional to connect to the system. So it's very diverse, but we are advancing, and true, as Natasha said in her presentation, that we have advanced a lot because of the COVID and during the COVID pandemic. And it's not yet that we have replaced the normal consultation by telephone consultation, because that is not digital. This is much more than that. But we were able to have the apps, we were able to have the digital certificate, we were connecting. And a small example that in the European Union, we have the network of rare diseases, the European Reference Network, and they usually connect among themselves, the professionals in different member states, to discuss cases of patients with a rare disease that are difficult, and to see to look for the expertise in different member states, in different regions or hospitals. Well, it came like a proposal from the health professionals, and in this case was the intensivists, that they wanted to use that network to discuss the cases at the beginning of the COVID, when they didn't know how to treat the COVID. They had people in the intensive care unit and they didn't have the expertise. So they were using that network. And not only that, but they proposed to train health professionals on intensive care skills. And that was really very good. I mean, and something that came from the professionals themselves, and that we funded and we supported, and we managed to train 17,000 health professionals. That is a lot. So now we want to give a push with all the funds that have been made available for in the budget 2021-2027 in all the different programs to push for this digital. I mean, not only the EU for Health program. This is the classical one. Is our program. So it's not. Unexpected that we are going to fund this the European health data space and the primary and secondary use of health data, but we are going to give a push for that, and this year we will be financing with 32 million euros. I mean, taking into account that the whole budget of 2020 for all the areas was 60 million euros, that in 2021 we have half of that, so 32 just for digital. I think that is a signal, but we will be also financing via other different programs. I mean, not only research. You heard these days about the Horizon Europe and the health cluster that is dedicating some funding to digital, but we have the Digital Europe program for the digital technologies in areas of public interest. We are going to use that program also to build the EU health data space, the supercomputing capacity. For example, I mean, I know that this is not interoperability, I know, but let me just make some advertising of everything that we are going to do. with this supercomputing capacity, we have been testing different molecules that already existed to see if they are useful to treat the COVID. And we have discovered some ones that now are on clinical trials. So that this is something that we couldn't have done that before with our means, but with the supercomputing now is possible to do that. We are dedicating also via the Connecting Europe facility, using for the high capacity digital network and infrastructure, also for the health system. We are going to use the Recovery and the Resilience facility and the REACT EU. Those are part of the next generation that everybody has heard about that, and with a lot of potential funds for digital. The cohesion policy funds also will be dedicated to digital tools and solutions such as the telemedicine and the Invest EU. So we are now, and maybe you remember when some years ago we were using what at the time we called the regional funds that were used to build infrastructures, health infrastructures too. Now we are using that in a more intelligent way. We are also dedicating or allowing the member state, because at the end, the member states have to want to do that and present in the national plans a plan for digital technologies for health. We are given the possibility of using those funds for health, and in health for digital to upscale the health systems. And now it's clear for everybody that we cannot upscale the health system without investing in technologies and digital technologies, and much more imaginative that m-health, e-health. So it has to be something integral and for everybody. And a consequence of that, I think that will be also the interoperability that I remember that I was working on interoperability when I was still in Spain in '92 in one of the regions, and we already had one of these projects, European projects at the time, for interoperability and talking about the healthcare. So years after, we are not in the same. We are discussing the same topic, but not exactly in the same way. And we have advanced a lot, but we need still to push to become Estonian, as you said.
Indeed, my question was a bit facetious, but you went beyond the question to take the real points that you raised beautifully. The range of mechanisms, finance, regulation, information, as you said, the health data space that can make that a reality. Also, you touched upon a product that we did in the Observatory, the Commission for the Slovenian presidency. With the Slovenian presidency, actually, two protagonists here, Nick Fahy and Dimi Panteli, are around the table, as well Nicole Mauer, with actually what they did, what they have done. So our participants, please check our web, it will be there very soon, map all the tools within health but outside health that actually can be used to support the health systems, health reforms, and many of them are applicable to digital health. Very, very briefly, Isabella, as I need to move to the next panelist. It sounds to me that we have it all, and what we need is the political will. So, as you said beautifully, Isabel, once we got the COVID, the political will appeared, and all of a sudden we have the COVID certificate. The other day, talking about the Slovenian presidency, we had 4 ministers of health with the Slovenian, the Portuguese, the Italian, and the German. And actually, one area that they sang in a choir was more funds, more support, more sharing in digital health. Can I ask you a question, Isabel? Do you think that political will continue, will be maintained? Do you see really enormous change there, or are you more a skeptic?
I think that now is the moment, or in another way, if it's not now, will never be, because now we have the funds, so we have the money, and we have. I think that we have the political will, but it still has to be substantiated. The danger that I see is that some governments, or that the governments in general, see this manna of funds and have the temptation to use for other issues that will not be real in innovation. So we don't need, we need not to use the funds, all these funds that are coming, the recovery funds, etc., not to pay the factors, the bills that we already have, but to invest in the future. So I think that that there is the political will, but still the ministers of health need to be listened, to keep their power, and to convince the prime minister, the governments in general, that now is the moment to really to invest, but invest thinking in the future and invest where can provide. And I think that one of the areas that we don't need to forget is digital health in primary healthcare.
Thank you very much indeed. An area that also Natasha raised, primary healthcare and digital health, which gives me entrance to introduce Clayton Hamilton from WHO Euro, the professional there leading the work on digital health within the regional office. Clayton, welcome to our panel today. Clayton, I have a number of questions. One of them is starting also with what we're taking to Isabel, Clayton, which is, what is the office doing? We heard already a lot from that, some of that from Natasha. How is the office helping, will help further member states to implement, to deal with these obstacles to implementation? You have strong country work networks, not only in the EU, but in the broader definition of Europe, of the whole European region. Can you give us a quick sense of how do you support member states, where you see the obstacles, and what do you do to address these obstacles?
Thanks, Joseph, and thanks, Reinhard. And just to really start by saying how much I appreciate the opportunity to be part of today's summer school. So let me try and without giving too much detail, to just give kind of the brief introduction to what WHO is doing under the digital health flagships. You saw that Natasha presented 3 strategic objectives, and what we've tried to do in developing the digital health flagship is to take a step back and really look, or take a renewed look at, how can WHO position itself and have influence in supporting the member states in a meaningful way that's not replicating what others are doing, that's in fact quite the opposite, that's actually leveraging and joining the efforts of others, but doing so in a way that's actually reflecting public health values and the value of the definition of health, and what we can actually do to accelerate best practices that you've heard about during the summer school during this week. So firstly, Nick and Isabel have touched upon many of the aspects, and you will have heard of them during this week, all of those technical aspects that are very much a core part of what makes it what we call a digital health ecosystem. And these are not only technical aspects, as Nick mentioned, a lot of it is to do with implementation science and the way in which certain technologies are implemented, but it goes much, much further. It goes into areas of policy, governance, regulation, and even into, as you mentioned, Joseph, softer aspects of culture, of trust, and the way in which individuals have literacy to interact with different digital solutions. So what WHO, first and foremost, what we're trying to do is to actually crystallize in a much better way to bring together all of these different aspects that actually have been captured in different countries' developments of their digital health ecosystems, and represent them in a way that actually really explains very explicitly the how. How do countries digitalize their health systems? How do they develop digital health services? But how do they do it not just from a technical perspective, but from a perspective ensuring equity and quality in access to those services? And that's quite an important point to capture. That's quite a departure from simply throwing in technology as part of a digital transformation, and actually looking at saying, how are we best going to implement these technologies in a way that's going to ensure that those populations which would otherwise be marginalized or have difficulty in accessing the services are able to do so. So that's really what WHO's first position is, to try and bring all of these elements together and do so in a way that we can precipitate all of that knowledge and all of that discussion that's been ongoing for years and years. And I know, Joseph, that we all get a little bit frustrated at the lack of inertia, or the inertia, sorry, in these things sometimes, that it seems that we're not moving ahead. But in fact, we have, I would claim, all of the elements in order to do so. But it's just very difficult at times to actually bring them together and have them presented to the decision makers in a way that builds on their existing investments and gives them a roadmap on how and what to build for the future. So again, focusing very much on the how. The second thing that WHO is doing is really trying to focus a lot more on the question of equity and gender in terms of digitalization. And certainly from my perspective, I see it as a big gap. So there's really not been a lot of discussion around what we mean by equity in digital environments. And one of our greatest fears is that we're actually transposing existing inequities in our societies into the digital environments. How do we prevent that? What would success look like in environments where there is good equity between the use of digital solutions? And again, these are difficult, but they're not impossible to achieve. So the second part of what WHO is doing is casting much more spotlight and focus on issues of gender inequity in terms of digitalization. And then really the last of the three major initiatives is really about rethinking how health is actually delivered and how digital and data actually can contribute in moving away from systems which are inevitably today more reactionary based in terms of their care delivery to more preventative, health-based and predictive models of care. And I know for a lot of people, some of this sounds a lot like science fiction, but in many cases, it's actually not. We actually have the power and the means to leverage a lot of the data, which even countries have today, in order to provide a more predictive and a more preventative form of healthcare. So that's essentially trying to move health upstream in order to make health systems more sustainable and to prevent this constant increase in cost on the delivery of care. So in broad brushstrokes, they're the three major initiatives that WHO under the Digital Health Flagship are working on. And again, it's really all about bringing together a lot of the knowledge that we already have in our hands and making that knowledge in such a way that it's actually usable by health decision makers at the very top of the chain, but also right down into regions and in individual institutions.
Thank you very much indeed. I see that a lot of what you said chimes with what has been said by the other participants. A lot of the transformation of the change of the systems is something we keep forgetting. We fall too much on the trap of the technology. And as Natasha said all the time, the technology is there to support human resources. I have many other questions for you, but I need to move on because I realize now the chat box is burning with questions to all of you. So I should stop my own questions and keep pushing the panelists so we go back to the questions of our participants. So I'd like now to move to Antonio Maritati. Antonio, welcome. Antonio Maritati is representing today Agenas. I'm very excited about the co-partnership in the observatory between Agenas and the Veneto region. And actually, we wanted to ask Antonio a very relevant point because it chimes entirely with what we heard today from Isabel, which is how Antonio Agenas, who is the regional agency in Italy, working with all the regions, looking at the priorities, how is going to be using the Resilience and Recovery Fund, this 650 billion there, not all of them for health or for digital health, unfortunately, but how is going to use some of these funds and which kinds of priorities you see that Italy is putting those monies, in which priority areas, so we give a sense of how Italy is moving forward in that direction. Antonio.
Thank you very much, Joseph, for your question. Good afternoon, everyone. Italy, in its own recovery and resilience plan, has determined to devote a specific chapter in the framework of Mission 6, which is on healthcare, to strengthen healthcare at community level, thanks to the support and the strengthening of the telemedicine provisions. We have learned many things from the COVID pandemic emergency. We indeed are even more aware that community medicine is very important. There are two components in the Recovery and Resilience Plan, which has been approved for Italy, is putting the community care at the center, and that will be done through a reform. So community care as a key role. At the same time, we will have to speed up and accelerate digital innovations. Indeed, now we have many electronic tools available. COVID just accelerated an innovation process which had already started. Now we have to continue. As for community care, there are three main actions envisaged. One is to improve the integrated home care through telemedicine. We do think that the home is a key place to provide care, to get closer to patients. Thanks to telemedicine and the tools of teleconsultation, tele-reporting, tele-assistance and telemonitoring, we will be able to offer care services closer to our patients at home. Our government intends to support the over 65 population with integrated home care. And we want to go well above 10% of that age group to be assisted at home. And we want to be in line with European standards. For that reason, 4 out of the 7 billion envisaged for integrated home care, there are other 2 for community homes and 1 for hospitals. 1 billion is envisaged for medicine with 3 objectives. The aim is to fill the geographical and regional gaps in the field of care, while implementing the standards of care possible through technology, to have patients have a better experience of care, improve the level of efficiency of the different healthcare in Italy at regional level. By sharing the protocols from the north till the south, from the mountains to the sea. The telemedicine projects proposed to the regions will be funded. There will be a national tender based on the priorities and the guidelines defined by the Ministry of Health. In order to receive those funds, there will be 2 sets of priorities. First, to be integrated in terms of health care record, and to have platforms so that we can connect the different healthcare records digitally among the different regions. Then we will have projects which can be applied in different regions together, so that we could have telemedicine platforms which are easy to download, going beyond the borders of individual health districts or individual regions, so that the national healthcare system is more integrated through technologies and IT. Thank you very much.
Perfect. Thank you very much, Antonio. You already addressed my second question, which is, what I wanted to be a second question is how this technology is going to be integrating the work of the regions. But you gave us exactly what we wanted, a very good sense of how these funds are going to be used, the priorities are going to be used, and the role of digital health and telemedicine. So thank you very much for that. I'll push on because I still want to hear a bit more from the chat box. And last but not least, I'm very, very pleased to introduce my colleague, Dimitra Pantelli, who is a co-director of the summer school, together with Nick Fahy and our permanent director, Reinhard Busse. Dimi, are you happy with the summer school? I hope you're very happy because you guys did a great job, even I'm biased because I'm part of the family. I have many questions for you, but let me try one of the many I have for you, Dimi, today. You're an expert in HTA, an expert in innovation. You've been working in this field on transformation as well. Dimi, is all okay as long as it's digital is okay, right? So digital technology is going to be a value for money, it's going to have impact. Let's pour the money there, hundreds of millions. Are we happy about that? I mean, don't we need a bit of HTA there? We need a bit more critical thinking perhaps there. This came up actually in one question today in the Veneto session and throughout the week. How do we evaluate all that? How we steer all that? Sometimes I worry with lots of funds being poured, not on digital health only, but everywhere. Are we really going to get value for money, Dimi?
That's an excellent question, Giuseppe. Let me start with the first question, which was, I think, the most important one. Am I happy with the summer school? I'm more than happy with the summer school. I had the good fortune of attending all the sessions starting Monday. And I think we heard so much and so many interesting aspects and so many interesting motifs that kept coming back that I think we are reflecting on today. And for me, when we talk about evaluation, I like the provocative way that you put it. If we're happy by the fact that it's digital and then it's over and we don't need to check anymore, is that we heard both sides of not of the argument. Nobody's in favor of implementing without checking if it works. That's not just because of the safety and quality, as Natasha was talking about in her video, but also clearly about this eternal question that we have about making the best use of our limited resources within the health system. And digital health is not exempted from that, clearly. And I think there are a couple of things to say here. So just to close the bracket that I opened, we heard from a couple of our speakers that we actually don't have a plan for evaluation of the new COVID technology, digital health hubs or digital health technologies that we use because of COVID, which is on the side that says, we might be going a bit too fast without having an evaluation plan. But we also heard, as you mentioned this morning from colleagues in the Veneto, that they're working together with their health technology assessment experts to figure out how to do health technology assessment for I think for the new telemedicine program, but in any case for the new digital health applications. So I think the way to look at it is this: there are as long as there are telemedicine programs and they didn't start with COVID, there are also considerations about how to do a health technology assessment for them. There are methodological particularities because we're not looking at just the technology, but we're looking at an entire process of care that changes. And this means a different type of outcome, a different type of study. But there is quite a bit of expertise already from different settings on how to do this sort of thing. So where we are right now is that we actually need to capitalize on the fact that we have a number of tools on how to evaluate such technologies already, and we need to use them and ensure that evaluation protocols and evaluation modules are built into any introduction of such a technology. I mean, we know this in public health and in health policy, and for all of us who are here today, this is the plan, do, check, act logic, right? So we have to make sure that we are actually checking that what we're doing is working the way that we wanted it to work, meaning effectiveness and safety for patient-centeredness, but also efficient use of resources. And that we also—
Is it happening, Dimi? Sorry to interrupt you. Is this happening? Or is something you think is happening? We are building the evaluation?
I think as far as we heard throughout the school and as far as we know from the literature, it is happening in some cases, but it's not happening throughout. And I think for the pandemic, clearly, we all need to understand that the first line of business was we have to find a solution and we have to find it fast. But we've been in this line of business now for 18 months, so we need to especially if we're trying to look beyond and think about sustainable solutions, we need to make sure that this is an integral part of how we move forward. I can talk about this more, but I think, Giuseppe, I stop here.
Perfect. That's beautiful. I would like to hear much more from that. But let's give some protagonism to our participants. Florian Tile is nicely monitoring our chat box. Could you summarize, Florian, what are people saying? And then we'll pick up perhaps one or two of the questions very briefly in a Twitter fashion with our panelists. So can I have all the panelists' videos on, please, to join me here? And Florian will tell us what people saying, what people chatting.
Yeah, thanks very much, Joseph, and thanks to everyone who has given and provided some questions in the chat. There has in fact been quite some very high quality activity there. I would like to condense it really to three main topics that participants have looked at more closely, and to which they have developed some questions. And many of those really have been partially covered throughout the week, but they are nevertheless just as relevant now today as well. Let's start with one that has come from Maya. So we have seen that on the EU level, there has been some really impressive, innovative work lately, highlighting the digital COVID test certificate. So Maya is asking, to what extent can there be a stronger coordinating role on the EU or on supranational levels when it comes to other issues of digital health as well? For example, data sharing post the pandemic. The second question that Evgeny has kindly posed in the chat is making the link to something that Natasha has raised, the association between digital health and the health workforce. So Evgeny is asking to what extent we can ensure that expanding the digitalization of health services doesn't to some extent end up in actually reducing the health workforce, so replacing healthcare workers, either intentionally or unintentionally, as we've seen in some other sectors lately as well, of course. And then Roberto, as a third question here, I would like to give to the panel, is pointing out another crucial link, of course, between digital health and the environmental sustainability and climate action. As we've heard this morning in the Venice session a little bit, digital health could have a quite significant impact on reducing emissions of health services and also limiting the need for physical resource-heavy health infrastructures. What do panelists think? Is this also something to look more closely into, and what is the potential really when we think about digital health and the links to reducing emissions?
Beautiful questions, beautiful questions. Thank you very much, Florian, indeed. Let me direct two, but very, very quick answers, please, because we want to finish on time. It's Friday afternoon. The question on digital and the EU tools, Isabel, how you would react to that one? Can we sort of expand from the COVID certificate to other areas? Is that going to be a platform in which the EU can then move broader? It's a question I asked many ministers throughout the recent months myself. I'd like to have your views on that very briefly, Isabel. How you think? You think that's really a spring platform?
Well, yes and maybe. Yes, in the sense that, yes, of course, we are preparing now the expansion of what we call the European Health Data Space. And I have in front of me a document that is called, as some of our colleagues and Nick for sure know, options, legal aspect, and way forward. So we are discussing internally. We would like to have before the end of the year a public consultation on the way ahead, and we are now discussing well, the legal aspect, so which articles of the treaty will allow us to move ahead. We know that voluntarily, of course, we have this the health network, EU Health Network, or the e-health network that is has been meeting intensively in the last months because of the digital certificate, but before because of the apps and other issues. And that now this has been an advancement. This is a voluntary network of the member state, but is based has a legal basis, that is the directive, the cross-border directive. So now we are checking how we could advance on that, move ahead, And as the question, I mean, the colleague that has made the question, not just for the digital certificate, but for other issues, we are checking all the difference, as we usually do, the problems, the policy options, and the impact of EU action, and if we have the legal basis and how we would move. But I mean, this will be the main activity for Joanna that you had on Wednesday in this summer course. And yes, we are planning for that. And the maybe comes, I mean, I said yes and maybe. Yes, I have explained the maybe, because that will need, once that the Commission makes a proposal, we need the commitment of the Council and the Parliament. So the Member States will need to approve, and whatever we are going to present, and also to be endorsed by the Parliament. So we'll see, but see.
So it's more of a yes and a maybe, an optimist way to wrap up today. Thank you. And the next will go to Clayton, if that's okay with you, Clayton, as that came very much part of your speech, part of your remark, and part of those of Natasha, your colleague Natasha. We're talking about digital health supporting the human workforce, the health workforce. But of course, we're worried about the digital health getting rid of the health workforce with all these robots and all this AI. Certainly, there's less jobs for dermatologists, less jobs for radiologists, less jobs for pathologists. How do you see that? Very quickly. I'm just a bit facetious, Isabel, a bit facetious. I saw your face. No, but how do you see that? Seriously, do you think that are we supporting the health force or getting rid of the health workforce with digital health?
Thanks, Joseph. And I've tried to answer a little bit Evgeny's question in the chat. It's a question that we often get asked, and I think it's time to move beyond this question in many ways. We have such incredible shortages of health workforce professionals right across the WHO European region. And the most often implementation of digital technologies is to augment the existing provision of human healthcare. There is no perspective on the horizon at this point in time that there's going to be this mass unemployment of health workforce professionals due to the implementation of technology. However, I think it's an interesting perspective that we should keep our minds open and optimistic in terms of when digital technologies inevitably transform healthcare processes as we know them today, then yes, there will emerge new roles. Some roles may disappear, but others are very likely to emerge to fill their place or be employed in other perspectives. So I definitely see a net increase, not a net reduction in the healthcare workforce in terms of the digital transformation of health systems.
Impeccable, thank you. Even though I was facetious, you addressed it beautifully. We have a third question, which I particularly like, and I will allow the others who have not spoken to take their pick and take this one, which is this idea of linking digital health with the greenhouse effect, very much the One Health approach. One thing that COVID has told us about is everything is tied together: animal health, environmental health, health systems, and human health, of course. And the more we're able to show the impact, the cross impact between health and SDGs and health systems and environment and animal health and human health, the higher the chances we are that we work together, that we act on these determinants. Certainly, if digital health could demonstrate an impact on the greenhouse effects and so on, would be yet another reason to invest in it. Anyone wants to add a reflection on that? Be it Antonio, be it Nick or Dimi?
You possibly for the first time this week, Joseph, you managed to stun a panel into silence, which is impressive. So I was just going to, I did just want to pick up, I was going to say exactly the same thing as Clayton about the impact on jobs. And I just want to, I'm going to take 2 seconds, Joseph, just to build on that and just point out that we're actually in a stage with the constant volume of research and insight into health. And the publication of new scientific results, which is just becoming overwhelming. And the way in which we actually cope with this ever-increasing volume of knowledge is we have more and more and more narrow specialties within medicine. And actually, in a sense, digital solutions offer us a way out of this, because exactly as Clayton was saying, it actually gives us an alternative way of managing that, which might allow physicians and other healthcare workers to come back to the kind of relationship of a person to another person in a relationship of care and support and treatment, which is why so many people went into the caring professions in the first place. So I would entirely echo that, and I've put a reference in the chat to a relevant paper. On the resilience, so I think the resilience point is really, really important, and the analogy I would draw is actually with one of the fundamental digital health technologies, which is the internet. So the whole point about the internet when it was created as a network which was not centralized and which was not vulnerable to disruption in the same way as some other networking technologies. And I think one of the points which we have really seen during the COVID-19 pandemic is that some of our quite centralized ways of approaching healthcare are somewhat vulnerable to disruption. And so for me, the bit of digital health that really interests me actually isn't the, how can I say, the really big bits of shiny robotics and all the rest of this kind of stuff. The bit of digital health that really interests me, the vision, if you like, is imagine that it can be part of a concept of communities and local communities which are able to live in ways which are much less dependent upon very large systems, but where the health of the community and the education and the transport and the local provision of everything from food and other basic supplies uses digital technologies to allow us to work in a much more resilient, much more interdependent, much more localized way. And that would allow us to bring healthcare back to that local provision while still being able to draw on expertise from very far away when we needed it. And so for me, I see that as the type of digital healthcare and the type of digital health system which could enable a sort of a greater resilience within our communities and our societies and be a contributor to something which is less inward looking within the system, but which brings health and support to health back out into communities and back out into better link to primary care and the visions of public health we've had in the past. I don't know if that's sustainable question, Joseph, but that's what I was thinking of.
Perfect. And sustainable societies.
Exactly.
So for me now is, if not us, who, if not now, when, hopefully next summer school, that you're going to be leading colleagues on innovation will be able to show the leap forward, the leapfrogging that will be not undergone, but we undergoing within the next year and the next summer school. And now, with some delay as always, Reinhard, you and I love each other to death, and we always argue on one point. I'm always behind as a typical Southerner, and you're always on time as a typical Northerner, but still we love each other. And that's the point to say, Reinhard, I'm so grateful for your leadership of the summer school over the years, your directorship, your intellectual leadership, your emotional, your personal leadership. It's been a privilege for me to work with you, and I'd like you to close the summer school with some final words. Thank you, Reinhard.
Yes, thank you, Joseph. I mean, I was not thinking that we actually stopped this at 4:20. So, I mean, no, but in earnest, I think we did well in choosing the topic which we did, and I think it was also a very good moment in time, and clearly, as those of you in the audience who followed us would agree, that there were excellent speakers, excellent case reports. And just to summarize it in a few minutes, I think we have seen that a lot of things have been happening in the area of digital health throughout the pandemic. Some countries clearly had an advantage because they had done more before. So we had different starting points, and we saw that on Monday with the different starting points from Estonia and countries like Germany. We had the debate whether this is due to the health system as a tax-financed or social health insurance system, and we agreed that there are probably other points. So independent of the starting points, countries had these additional challenges And the challenges were particularly large for decentralized countries, no matter how they finance their health systems, when they had their data systems fragmented due to decentralization, they had particular big problems, at least initially. The challenge, I think, which we all saw, that it is now post-pandemic to leverage the momentum and to keep up the speed of the development which we saw over the last 18 months. And so we hopefully also the strengthening of the capacity, both human resources to deal with the digital health solutions, but also technical solutions were either strong enough, or we use the funding, as Antonio has explained for us in the case of Italy, to actually now see the necessity to use part of the recovery fund also to go into digital health to prepare ourselves for a non-crisis period, even though clearly we will also be better prepared than for the next for the next crisis. Digital health applications have helped to strengthen health service provision, both for the COVID patients, but also for the non-COVID patients. And we heard numerous examples throughout the week on various countries, regions, and so on. I think what we have also heard, that while we see that there are some pan-European things like the digital vaccination pass, that many of these solutions are very local, regional, and in many cases very context specific. So even though we can all sit back and say that there have been these many examples happening and we only need to keep the momentum, I think we also need to have a good approach at it to see what have we really learned, what is transferable, what are the success factors which make digital health solutions work in one country and maybe not in another one. We saw in these examples, we saw both the transformation of existing solutions. Remember the German intensive care telemedicine program called ERIC. We also saw the swift creation of new digital health applications like the intensive care platform in Veneto. But clearly, we need to be worried and help to overcome the danger that we see a landscape of islands of little digital health solutions. So the networking, and I know the Commission has this in view, always WHO has this in view, that this is really necessary to look at this. And I think we have over the last days also heard some key points to consider. The one thing is about the people, and we had just heard the question about the people maybe being, no longer necessary. And I totally agree with Clayton that we were, until the pandemic and during the pandemic, more or usually talking about the shortage of the health workforce. And maybe we now see that we can decrease the shortage of the workforce, and we should all remember that the workforce shortage is much bigger in the global south. And I think we all should think of how we can help the global south to overcome the workforce shortages by digital health solutions. And being a bit aware of what is happening there, I can tell you that they are working on this themselves. So people are key. We need to bring people on board, both the professionals, the providers, and we need to make sure that they are motivated. And part of the motivation is also that we need to think whether we should pay them. We should not only pay for the technical solutions, We also have to see how this impacts on the way they deliver care, and whether some usage of digital health solutions needs to be reimbursed better, while maybe other ones we can reduce the reimbursement. Next to the professionals, we have the patients or the citizens, which we need to bring on board. And I think we heard that there is relatively large agreement that the citizens can actually be brought on board even more. If they understand what the data are for, they probably are willing more to share their data than sometimes politicians. Maybe they are hiding for data protection things because they are. This is my thought here, that politicians often don't want transparency, and they say we need to protect the data. So we should really bring the persons more on board, because there are a lot of data. There are a lot of data in the countries often not brought into digital health solutions. So the challenge now in the post-pandemic era will be to see which data are good data, how to link them, and how can we share them with the practitioners, with the researchers, to improve both the research and the care for people. Public-private partnerships have been touched upon, are important. The role of the public sector has probably been strengthened. We know that people are more worried about giving data to private organizations, so that we will have the debate of the new role of the governments, of the state in this whole maneuver. And we have to see that while digital health solutions have the potential to increase inequities by reaching out to rural populations and so on, they also have the potential to increase inequalities, because not all citizens, not all patients have the same health literacy, the same digital health literacy. So we have to keep this inequalities or equalities in mind. And Dimitra has been touching upon, based on your question, Joseph, we need to evaluate digital health solutions. We cannot assume, like we used to do in pharmaceuticals and later on medical devices, just because they are new, they are good. We need to be critical. Digital health solutions, we will find ones which are clearly beneficial, provide a good cost effectiveness for healthcare. We will see that other ones don't work, are bad value for money, and this has to come highly on the agenda. And I hope maybe that we can sneak in digital health into the European HTA approach at the last minute. And above all, and partly this was today, was about leadership and political commitment are key at the European international level, at the national level, and below national levels. And we also, as the observatory, so I thank all the speakers again, but we also want to keep the momentum and take the next summer school and look at innovation more broader. And then I think we will try to compare digital health innovations with other innovations or other areas of innovations where digital health plays a role, and some where digital health does not play a role, because digital health in itself is not the big issue. It is how to innovate, make our health systems higher performing, better. And we have other solutions, clearly. So that will be next year's summer school. And please keep alert for our announcements when we say when it will be and how you can apply. Thanks to everybody, both to the speakers, the participants, the panelists, but also especially to the audience. The summer school is nothing without our audience. So thank you all. Bye-bye.